Pressure is mounting on National Cabinet to resolve the issue of border closures as local communities and businesses count the cost of tough restrictions. The Prime Minister and state and territory leaders meet today and they've been told they must find a solution. The hard borders are taking a toll on regional residents, with farmers and people needing medical care hit especially hard.
Federal Agriculture Minister David Littleproud says the states risk becoming irrelevant if they can't solve the border crisis. And Qantas has joined tourism and business groups to express growing frustration over rules they see as being driven by politics and not by health advice. Now, hundreds of staff and children at a Brisbane Youth Detention Centre are being tested for COVID-19. It follows confirmation that a worker has contracted the virus. Queensland Health says the woman in her 70s did 5 shifts while she was infectious.
The closure of South Australia's border with Victoria has come into effect overnight. From today, only students in years 11 and 12 and farmers living near the border will be given travel exemptions. The closure has angered border residents who say the impact on their communities will be devastating.
The West Australian government is set to force people considered to be a quarantine flight risk to wear electronic monitoring bracelets. It follows the escape of 2 women from hotel quarantine in Perth earlier this week. The Premier, Mike McGowan, says those who are high risk may have to pay to stay in a separate hotel with higher security.
Filthy rooms and COVID-positive guests leaving quarantine early. These are some of the latest claims to emerge from Melbourne's hotel quarantine inquiry. Yesterday's hearing was told Department of Health and Human Services staff struggle to keep track of guests, with one family going a week without being checked on. A nurse who gave evidence said one guest was released early without a second test, despite testing positive for COVID-19 days earlier.
I was told I was not to swab him. He has not had symptoms for 3 days. He will be leaving quarantine early, which didn't make any sense at all.
Let's get an update on the coronavirus outbreaks in the eastern states. Our reporters, Talissa Saganto, Steph Ferrier and Kathleen Ferguson are all standing by. We're going to start in Queensland with Talissa. What's the latest on the Youth Detention Centre?
Well, our latest case here in Queensland was a 77-year-old Ipswich woman who worked here at the Youth Detention Centre in Brisbane, which is in Wacol. Now, Queensland Health have told us that this woman worked 5 shifts while she was infectious. We've actually spoken to a close family member of this woman who has refuted that and said she actually only had a headache, but nonetheless, it's triggered a wide health response here at the facility. Once she tested positive on Wednesday night, the whole centre went into a full lockdown, which meant 127 detainees were all confined to their rooms. Some of these young children are 13 years old now. Whilst they wait for their test results, about half of them have already been tested and they are expected back either today or in the next couple of days. In the meantime, Queensland Health also have to test over 500 staff members who work here in total. That is casual staff and contract staff, as well as education and health staff. Now, thankfully, there was already a ban on visitors at this facility whilst the woman was working, so that does make things a little easier for contact tracers. We're also told that her role didn't actually involve her needing to be in the accommodation sector, which means that she wasn't in fact in close proximity to many of the detainees, and she only had a limited contact with a small number of them. But guys, the biggest issue for health authorities here in Queensland is determining exactly where this woman contracted this virus. She's told contact tracers that she hasn't been overseas or interstate recently, and there's been no confirmed links to any cases here in Queensland. It's been a month before this case that we've had any community transmission, so undoubtedly health officials here don't want any other further community transmission potentially from this woman, so they're desperately trying to figure out the source of this infection, and that's what they'll be focusing their efforts on today.
Thanks, Talissa. Steph, in Melbourne, what's the latest with the state's figures?
Hi Lisa, yes, new case numbers continue to trend down, and there's also been a big drop of around 2,000 in active case numbers, although that's attributed to an administrative backlog that's now being cleared. Sadly, there were another 13 deaths yesterday, and new data has also revealed more than 750 mystery cases are spread across some 43 local government areas, mainly in Melbourne's north and west, and that could delay the easing of stage 4 restrictions. We also have heard some explosive revelations about the lax standards at Melbourne's hotel quarantine fiasco that sparked this deadly second wave. A lawyer who was forced to quarantine at the Ridges on Swanston Hotel has given photographs to an independent inquiry showing the filthy room that he was asked to quarantine in with his family, including discarded gloves on the floor, food scraps and even a blood-stained doona. One nurse has told the inquiry as well that health officials lost track of returned travellers and threats of suicide were dismissed, while another nurse has described the situation as shambolic. He says that he was directed not to swab a guest who had tested positive just 3 days earlier because he hadn't shown any symptoms for 3 days and was going to be released from quarantine earlier. And he says that that just simply did not make any sense. He also says that it was clear that guards didn't have proper training in infection control. Many were wearing their masks below their chin and also continued to eat lunch with their gloves on. And today we're expected to hear for the first time from one of the security guards who worked at this hotel program. So there's no doubt going to be more disturbing revelations ahead, Lisa.
Oh, that will be interesting. Thanks. Kathleen in New South Wales, how's it looking there?
Hi Lisa. So there have been 5 new cases reported in New South Wales in the most recent reporting period, but there's some good news though. There was more than 28,000 tests, which the government has applauded and had really been pushing for high testing numbers. Now 2 overseas travellers who have returned, and then the other 3 are locally acquired from southwest Sydney. And again, that's the authorities' focus, is that southwestern Sydney area where there are mystery cases and some of the sources of those cases are unknown. On the border issue in New South Wales, the Deputy Premier, John Barilaro, has broken ranks with his coalition counterparts, really pushing for the border measures to be relaxed before Christmas. And the Premier, Gladys Berejiklian, said yesterday that she couldn't see any point in putting a time limit on that at this point.
OK, thank you to all 3 of you. I want to stay with the border issue and hone in on that New South Wales-Queensland border divide that's causing so much controversy. Our reporter Bruce McKenzie joins us from Ocean Shores, just outside the border bubble. Good morning to you. What are the biggest issues for people living in that area?
Well, the biggest issue up until now has certainly been health, and pleased to report there is some relief amongst the community, at least among those people that required specialist treatment over the border on the Gold Coast. The quarantine requirements have been relaxed in recent days, so people needing those services now no longer have to go into quarantine for the full 2 weeks. Now it's just for the period of their actual treatment. So that has definitely been welcomed. But there are still some lingering issues as far as health is concerned. A lot of them concern doctors who live over the border in Queensland but work outside that border bubble. Here at Ocean Shores, the local GP clinic usually has 12 doctors on duty. Now that's been reduced to 6 because of that situation. And when you extrapolate that out to some of the major hospitals like Byron Central Hospital or the Lismore base, you're talking more than 100 doctors affected by that situation. And of course there are a lot of families in this area that might have parents or children either side of the border, and they don't know when they'll see each other next, and that's definitely still an issue.
Yeah, and Bruce, even while we've been on air, we've had so many people messaging in, telling us their own personal stories, but of course it's this constant debate, isn't it, between the health and the economy. So what's been the ongoing economic impact of the border closure in that area?
Well, certainly here in the Byron Shire, it's a huge impact. Basically, they've turned off the tap for that really lucrative day tripper market of people coming down just for the day from Queensland and spending their money in this area. And we're talking about an economy that's already suffered the loss of big events like the Easter Blues Fest and the Splendour in the Grass Music Festival. They usually pump tens of millions of dollars into this economy. And let's face it, tourism is the lifeblood of this economy, and basically that's been slowed to a trickle.
Bruce McKenzie, thanks for giving us the most delightful outlook there behind you as well. I've been admiring that. It looks fantastic. Ocean shores. We're all jealous, you know, down here in Victoria. Thank you.
As you should be, but yeah, it looks beautiful, but the situation is a bit bleak.
Yeah. Thanks, Bruce, for filling us in.